The total count of COVID-19 cases in Singapore has passed the 20,000 mark, with 788 new cases confirmed as of noon today. The Health Ministry said 11 of the new cases are Singaporeans and permanent residents. Migrant workers living in dormitories continue to make up the bulk of the remaining cases.
The full breakdown of the new cases will be released later today. Singapore now has a total of 20,198 cases, the most in Southeast Asia.
Let's discuss this further with Dr. Leong Hoe Nam, an infectious diseases physician at the Rophi Clinic at Mount Elizabeth Novena. Doctor, Singapore crossed the 20,000 mark today. How significant is this number given the size of Singapore's population? Should we be surprised?
If you look at the number, I think it's just too many. But you have to take into the context that the majority of the 12,000 which we're seeing are actually from dormitory, representing the foreign workers. But if you look at the community at large, the number of infections that are unlinked are less than 5 every day for the last few days. So, as a big number, it's terrible because it's coming from the foreign workers' dormitory. Now, I'm not too worried about it because the foreign workers' dormitory are all contained. They are not allowed to leave at this point in time, and neither can anyone go in without special permission, which means the numbers are there. The numbers will grow as we find out more and more about them, but it will not pose a greater risk to the community out in Singapore. Then, as for the community out in Singapore, the number of cases are only about less than 5 a day, which are unlinked. So the probability of getting infected is less than 5 per million. Less than 5 per 5 million or less than 1 per million. The chance of getting it is very, very small. We're back to the days in February. So in that respect, I am not worried. However, this number is not the end game. In fact, I expect the numbers to go more and more. As the Singapore government extends its search and completes its search of the foreign workers' dormitories, I would expect the numbers to increase by several thousands, even to 20 or 30,000. But Singaporeans shouldn't be worried because Singapore is fine. For the foreign workers, the overwhelming majority are very young people. They have very, very mild symptoms, which means that they are going to come through the whole illness unscathed. Nonetheless, the healthcare system of Singapore is backing up our foreign worker population.
Right. Doctor, what else does the total figure of over 20,000 cases tell us? For instance, does it mean that we need more stringent measures? I know you just mentioned that we shouldn't be worried as a population, or is it a matter of us keeping at what we're doing currently and needing time for the circuit breaker to do its work?
I think rather what it tells us is we need to work even harder for the foreign workers' dormitory. We need to separate out the clean cases, as in cases that are not infected, versus the infected cases, and tease them out so as to stop the transmission with the foreign workers. As we are speaking now, I'm very sure there are many cases which were infected in early April that have yet to be diagnosed, and I'm very sure there are cases who are still being actively transmitted or infected currently because they have not been teased out to who is infected and who's not infected. This just tells us that we have to work harder for our foreign workers, and that way we can keep the numbers down. Mind you, 200 to 300,000 foreign workers is a huge number. It's a tall order to even try to tease them out within the limitations of the dormitory and within the circumstances in Singapore. So, Singaporeans, you just have to be patient. This problem will be solved eventually. What we need is time, a bit of space, and then we'll get it solved eventually.
Doctor, still on numbers and figures. Now, the number of new cases has been below 1,000 for the past 12 days. Do you think the virus has peaked here in Singapore?
I think in terms of absolute numbers, the peak infection is probably over. The numbers of 500 to 800, which we see every day, represents the cases that were infected earlier. Now, I expect the numbers to remain hover about the same. There might be some fluctuations of a few hundreds every day, but in the next 2 to 3 weeks, you see a downward trend in the numbers as we sieve out more and more of the foreign workers who have the infection and work them out correctly.
Dr. Leong, a 20-year-old nurse was confirmed as a case yesterday. He's the third healthcare worker from the community care facility at Singapore Expo to be identified as a confirmed case just in the past week. So what does this say about healthcare workers in these makeshift facilities compared to those, say, in the hospitals?
There are a few points which you can learn from this. Not just in Singapore, but in China and overseas, most of the healthcare workers do not get infected while at work. That's because they have the proper gear. You're talking about the mask, you're talking about the goggles or the eye shields, as well as the protective gown the person wears. And this has been proven very, very effective for all healthcare workers. So in this respect, I think that the infection probably occurred even from the person at home or when the person is traveling to and fro from work. Remember, there are up to 5 cases of unlinked transmissions happening in Singapore now. For all we know, this healthcare worker acquired it whilst traveling to and from work. In terms of the healthcare workers' protection and gear that's supplied, it has been proven many, many, many times that it is very effective. I must, however, admit that there is a possibility that there was a breach in infection control during the donning of the gowns or when the healthcare workers meet those people who are infected individuals. It also serves as a reminder to all healthcare workers that we have to be extremely vigilant when we're looking after patients with COVID-19. It also illustrates one further point. Healthcare workers are putting their lives on the line when we actually serve and look after these individuals. And I am very, very happy that many volunteers have come forward and people who are non-healthcare trained to come forward to help look after these patients. I hope that these cases that appear do not deter these volunteers from coming forward, but instead serves to encourage them to be even more vigilant and more careful so that they can look after themselves and yet be of service to the nation.
Well, Dr. Leong, it's always a pleasure having you on the show. We've been speaking to infectious diseases physician at the Rophi Clinic, Dr. Leong Hoe Nam.